Hi, everyone. Good evening. My name is Bethany Yeiser. I'm president of the CURESZ Foundation, and CURESS stands for Comprehensive Understanding via Research and Education into Schizophrenia. It is my pleasure to introduce Dr. William Resch tonight, who will deliver a speech on famous people with mental health disorders, especially schizophrenia. Quickly about Dr. Resch. He is an outpatient psychiatrist at Ohio Health Riverside Hospital in Columbus, Ohio. He's an assistant professor of psychiatry and discipline director at Ohio University Heritage College of Osteopathic Medicine. He's a distinguished fellow of the American Psychiatric Association, he is board certified by APPN and ACONP with expertise in treatment-resistant mood disorders and also integrated care, neuromodulation. He is actively involved with residency education and programs in Central Ohio. So welcome, Dr. Rush, and the floor is yours.
Thank you. Good evening, everyone. Thank you, Bethany, for that kind introduction. I'm really glad to be here this evening. I appreciate all of you taking the time to attend this Cures lecture. This was another topic that turned out to be a lot of fun to put together, and I'm really looking forward to sharing it with you tonight. So I entitled the talk, Brilliant Minds, Human Struggles, Famous People, and Mental Illness. Not going to read these formal objectives in the interest of time, but we're going to highlight kind of why we want to discuss this topic and look at 15 good examples of looking at people, well-known people that have had mental health conditions can help others. So that's kind of the main gist of this. I have no conflicts of interests regarding this talk. I do want to make sure I make this point clear. I'm a practicing psychiatrist for going on 27 years. I've been a member of the American Psychiatric Association that whole time. And as such, we are given a set of professional guidelines and ethical topics to follow. And one of these is this thing called the Goldwater Rule. And the Goldwater Rule basically states that it's unethical for psychiatrists like myself to offer professional opinion on people that we haven't really directly assessed. And I haven't directly assessed any of the people that we're going to talk about tonight. I've seen two of them talk in person, which was great, but I've never done a formal evaluation. And this all stems from in 1964, a presidential election, Barry Goldwater, this magazine called Fact here, polled a bunch of psychiatrists who offered opinions, and it went into this magazine and could have affected the election somehow. So it resulted in this recommendation and guideline that I want to follow. So it basically says that I can educate generally about psychiatric conditions, assessment and treatment, like I'm going to do tonight, comment descriptively on what's already out there, put out by the person themselves on their diagnoses without any further clinical opinion. That's as far as I'll go. Um, and I don't clearly diagnose anybody I haven't seen, personally in my office. So I can just explain in general what's been previously put out there and what is all available to all of you through, literature and the internet and the things like that. So nothing beyond that. So I just wanted to get that out there. So why this topic in lecture? And when Bethany and I talked about it a couple months ago, I was like, yeah, that's going to be a good topic to do. And there's a lot of reasons we can talk about well-known figures with mental health conditions. First, we want to kind of normalize mental illness, which is always important to highlight the fact that it knows no boundaries in terms of age, race, religion, culture, etc. We want to reduce shame and stigma, which we'll get into shortly. We certainly want to emphasize treatment, recovery, dignity all throughout. We want to always encourage people to seek help and get treatment to help them. We want to discourage help rejecting philosophies and mentalities. So people say, hey, it's okay to ask for help and you don't have to deal with this yourself. So we want to, again, normalize it and show that mental illness knows no boundaries. These 15 individuals that we're going to hit shortly are famous because of their, not famous because of their mental illness, but because they lived meaningful lives with mental illness. So a key take-home point there. And I think talking about these individuals can serve several important purposes, both clinically and socially speaking. The first is regarding stigma. Mental health stigma is this negative attitude, stereotypes, discrimination directed towards people with mental health conditions, and it can lead to shame, exclusion, and put up barriers to people from getting the treatment that they need and would be better off with. So we want to do anything we can to reduce shame and stigma. Additionally, stories like this and people like this can highlight specific disorders, whether it be schizophrenia or we'll talk about OCD and eating disorders. It helps the general public better understand them as a whole, because sometimes, they're a little hard to understand in comparison to physical illnesses sometimes. So this helps build awareness and education. Additionally, famous people, given their positions and their high profiles, they can serve as role models by showing that it's possible to manage mental illness and still lead very successful, fulfilling lives. It provides hope to both the patients and their families who might otherwise feel isolated and hopeless. Sometimes people probably feel like they're the only people out there suffering like that or dealing with mental health conditions. So this kind of helps in that area too. Role modeling and hope. Insight. This is a really important aspect of all mental health conditions, to have enough insight and awareness to look at all the manifestations of these psychiatric disorders. It can be kind of complex sometimes. Some of the treatment challenges and the recovery trajectories, which is very different from person to person. These are very heterogeneous illnesses with very heterogeneous treatments, meaning they're not all the same. Everybody's kind of got their unique characteristics, symptoms, treatments, etc. So it kind of makes these abstract concepts more relatable and memorable to everyone. Additionally, advocacy policy influence is really important. There's some really high profile people that can make a difference in terms of mental health advocacy, increase funding into research and programs and services to help people live better lives and be safer, and influence public policy where it kind of all starts. There's some prime examples. I was thinking about this out there. One of the prime examples I think in modern times recently is Michael J. Fox. Since his diagnosis with Parkinson's disease back in 1991, if you can believe that, he's been this really staunch advocate for Parkinson's disease in terms of education, awareness, and research. And he's just done tremendous things in the world of Parkinson's with his foundation here, as you can see here in these uh, outlets here. Additionally, I'm a big sports guy. This former NFL player, his name was Steve Gleason, played for the New Orleans Saints. Unfortunately, he was diagnosed with ALS or Lou Gehrig's disease after his career was over. But he, like Michael J. Fox, turned into this very staunch advocate to increase awareness, funding, research into the area of ALS or Lou Gehrig's disease. He started his foundation, No White Flags. He's done amazing things in terms of encouraging change in the federal law. There's a Steve Gleason Act, which gives people with ALS communication devices through insurances to be able to communicate more effectively for the patients and the family. For this work, he's gotten a Congressional Gold Medal for the efforts, the advocacy, the funding, the research, the change that he's been able to implement. He's also won an ESPY award, as you can see here, presented by his son, River. And when I think about these, amazing people doing these amazing things, I don't know if we have an exact equivalent in mental health. Um, that may be open to conjecture, but in terms of their personal story, sustained large scale advocacy, we have some people that are doing some really good things, as you can see here, but I don't think on par with Fox and Gleason. Maybe down the road we can, but uh, additionally, I think discussing people like we're going to discuss can teach us about how the media sometimes portrays mental health conditions, not always perfectly accurate, unfortunately. Sometimes it's sensationalized. It's definitely sensationalized in TV, movies, Hollywood sometimes. So things like this, real world stories, help distinguish that fact from stigma and being too sensationalized. So talking more about famous people with mental illness, like we're going to do tonight, is certainly not about gossip, but more about education, humanization, advocacy, and fostering understanding and hope. It connects clinical realities to everyday life in a way that's really more relatable and impactful. So when I was putting this talk together, there are a couple ground rules I wanted to set forth. I want to use only documented diagnoses or widely acknowledged lived experiences, again, to comply to that Goldwater rule and recommendation by my governing professional organization. I want to avoid glamorizing any suffering. I want to emphasize treatment in a help seeking, promoting kind of way. I want to promote support, recovery, focus on strengths and challenges, not on tragedy alone. So, with that, um, we'll go ahead and get started. Oh, this is another good example. When I was in residency at Ohio State, I periodically see these posters in clinics and different wards, and it kind of reminded me, like, hey, I didn't realize this or that, and it helped kind of do the things we just talked about, normalize mental illness with some of these really famous people, and they were still able to live very meaningful, productive lives. So with that, one of my favorite advocacy groups is NAMI, National Alliance on Mental Illness, and they do a variant of this. They don't really call it famous people with mental illness. They are more about mental health champions, whether they have, you know, fame or not. So they'll talk about mental health champions, stigma-free ambassadors, and just really highlight people with lived experiences of mental health conditions, similar to what the CURESZ newsletter does. Highlights people that are living full and productive lives. So here's the 7 categories of the disorders that we're going to cover in this lecture. I highlight schizophrenia more than anything because it's the hallmark of this organization. So there's 4 people out of the 15 that we'll talk about that have disclosed diagnosis of schizophrenia. But we'll start off with mood disorders. Very common psychiatric condition. The first mood disorder is a very famous person that I'm sure you'll all know. He's probably one of the most well-known figures in American history, and that is of our 16th president, Abraham Lincoln. You probably remember from school, he was born in Hodgenville, Kentucky, in a log cabin, very on a farm, very rural, not a lot of money. He endured a lot of early trauma, adverse childhood experiences, as we call it. His mother died a very difficult death when he was age 9. A couple years later, he lost his sister. He then got kicked in the head by a horse, some form of head injury, concussion. And then after that, he endured a father that was pretty strict, a disciplinarian, very cold. Despite all these adverse childhood experiences, he was still able to become a lawyer, a legislator in the Illinois State Congress, a congressman, and then, of course, the rest is history. Became the 16th president of the United States during a very pivotal, formative part of our country. He led our nation through succession, civil war, emancipation. His leadership emphasized democracy, equality, national unity. And for all these reasons, he's widely regarded as one of the most influential U.S. presidents of all time. That's why he's on Mount Rushmore. But a lot of people that I come across even today don't realize how much he suffered or he dealt with major depressive disorder. As you can see here, this very good book I've read by Joshua Shank details it very well in not only his firsthand accounts in terms of writings and journals and letters, but also second and third hand accounts of people that witnessed Lincoln's melancholy and, you know, lived around him and was around him a lot. And obviously, that's the old term. We don't use melancholy anymore, but that was the old term for depression. And his symptoms, detailed in this book, really mirror much of the same symptoms we look for in today's diagnosis of major depressive disorder: persistent, long lasting sadness, hopelessness, psychomotor slowing, social withdrawal, and rumination on death. If we were to use modern day terminology, his symptoms probably fall under the category of major depressive disorder, recurrent in nature, moderate severity, and with occasional suicidal ideation, which we'll get to. But Abraham Lincoln had about four distinct episodes that are well documented. The first one was in early adulthood, as he was setting out, dealing with all those traumas. Then in 1835, after the death of his first love, Anne Rutledge, which he grieved very hard. And then in 1841, he had a temporarily called off engagement with Mary Todd Lincoln, who he later married. But it was very tough and led to a depressive episode. And then finally, throughout the Civil War, throughout intense political stress periods, he would have more depression. And there are many accounts that during these times, his friends would sometimes put him on suicide watch because they were afraid of his safety. And they would remove knives and razors during these depressive episodes. And when Lincoln was dealing with this type of depression slash melancholy, there wasn't a lot of treatment. It was way before like Sigmund Freud and, significant psychotherapy was on the scene. It was way before medications. A historic treatment of that day was this thing called blue mass pills, which was a tonic that contained, believe it or not, high concentrations of mercury, which probably led to more mood instability. He eventually figured that out, stopped it, but did try to, treat and medicate in that way. Look at this quote from the 1841 time period around the time of his engagement that was called off. He states, "I am now the most miserable man living. If what I would feel were equally distributed to the whole human family, there would not be one cheerful face on the earth." So again, highlighting the severity of symptoms and what he felt, the weight of it and the gravity. Despite this depression, he was still able to demonstrate, advanced high level executive functioning to do what he did and to have the success that he did. He showed a lot of emotional insight and empathy, and a lot of people like Joshua Schenck think that the depression helped, fuel that and get him to be a better leader, show more moral reasoning with the decisions he had to make. As coping strategies, he used a lot of humor, storytelling, intellectual engagement, what we call intellectualization, as main coping strategies. And like I said, his depression may have contributed to more empathy that he had for people, reflective leadership style to make better decisions for the country. And since 1970, there's a topic called depressive realism, that means when people have depression, they tend to see things more rationally, more practical, and more realistic than if you don't ever experience depression. So that's kind of an example of this depression shaped him into this wonderful leader. And he's certainly a great example, as all these people are tonight, that mental illness can coexist with extraordinary leadership, resilience, and historical impact. Moving to the next well-known figure, another political leader here, Winston Churchill. As you know, he was a British statesman, writer, wartime prime minister. He led England through the World War II. He also was renowned as an orator, a lot of resilience, a lot of leadership under crisis when the Nazis were bombing London and the like. And he's actually the first of two people that I'm going to highlight tonight that has won a Nobel Prize. He didn't win a Nobel Prize for leadership, but for literature. He was that good of a writer. It was one of his coping strategies. And much like Lincoln was probably the most influential leader of the 19th century, he may be one of the most influential leaders of the 20th century. But much like Lincoln, he dealt with major depressive disorder. He actually named his major depressive disorder. He called it the Black Dog. And he openly referred to the Black Dog And he experienced this black dog, bouts of depression during, periods of intense stress, inactivity, which is not uncommon. His symptoms, much like Lincoln, included DSM like symptoms of low mood, pessimism, rumination, periods of social withdrawal, reduced motivation. This really good Esquire magazine article in 1969 details it very well. This artist by the name of Scarf, he actually tried to capture the inner torment that Churchill was feeling in this kind of interesting artwork here. Fortunately, it did not lead to any psychosis in him, and his functioning remained fairly high despite his symptoms. He also had coping styles and strategies like Lincoln. He, did a lot of intense work. He wrote a lot to the point where won that Nobel Prize. He did a lot of physical activity. He painted, as you can see here in this picture, and kept to a strict routine. Another prime example of effective leadership coexisting with mental illness. And he's cited as an example of an emotional struggle does not prevent extraordinary achievement sometimes. And it also shows his resilience without romanticizing this illness. And look at this quote: "My black dog seems quite away from me now that when he was recovered. It is such a relief. All the colors come back into the picture." A great kind of descriptor that leads to more insight, awareness, appreciation of what major depression is. It changes how you view the world around you and can't even see colors in the same way you can when you're recovered. Our third mood disorder is Princess Leia. I'm a child of the 70s and 80s, so I remember Princess Leia very well in the Star Wars trilogy. Her real life name was Carrie Fisher, and Carrie Fisher is now passed, but she was an actress, writer, screenwriter. Her most prominent role was probably Princess Leia in Star Wars, but she also wrote a lot of books. This one here, Postcards from the Edge, kind of was a semi autobiographical pieces of what she dealt with her mood disorder slash bipolar disorder. She was known for her sharp wit, honesty, public advocacy. And she was very open with her diagnosis of bipolar disorder. She actually came out on 2020, if you remember that show back in the days. And she stated that she was diagnosed in her early 20s, which again is right about the time we see a lot of mood disorders present in people. And she experienced pretty significant mania, depressive episodes, and even episodes of psychosis where she started to kind of lose touch with reality. And for that severity, she has the most severe form of bipolar disorder called type 1. This type 1 bipolar disorder led to a lot of hospitalizations. It also not infrequently co-occurs with substance use and substance use disorders in about 50% of people with bipolar disorder type 1 per NIH studies. And she would use periodically alcohol, cocaine, and prescription medications. So like I said, these led to various hospitalizations. Sometimes when medications would not fully help her recover, she would actually undergo electroconvulsive therapy, a very effective, safe, quick way to help treat people with refractory mood disorders and can be very life-saving. She was even open about her hospitalizations and ECT treatments. So, like I said, she spoke very openly about this serious mental illness. And look at this quote here. "At times, being bipolar can be an all-consuming challenge requiring a lot of stamina and more courage. So if you're living with this illness and functioning at all, it's something to be proud of, not ashamed of." She used humor in writing to reduce stigma, going back to that previous slide. Normalizing treatment, also mentioned in the previous slide. Emphasized adherence to medication and ongoing care. That's very important in mood disorders as well as uh, schizophrenia, where you have to stay on medications consistently to minimize the chances of recurrence or relapse. So much like everybody tonight, she's widely cited as a powerful example that creativity, productivity, and mental illness can coexist. We just talked about two leaders. Now this is more of a creative mind in the acting world. And this is a nice quote here that's definitely helps seeking encouragement. There is treatment and a variety of medications that can alleviate your symptoms. If you're a manic depressive or depressive, you can lead a normal life, whatever that is. So again, part of this talk is to be educational. So as we transition to the next category, I just want to do a few teaching points for mood disorders. Major depression is a very real medical illness that affects mood, thinking, sleep, energy, appetite, daily functioning. It's more than feeling sad for a few minutes, a few hours, even a day. We're talking 2 weeks or more of sustained mood with impairment and distress in various parts of your life. It actually is a leading cause of disability worldwide since 2017. It's common, but very treatable. Many people recover significantly with appropriate help and treatment. Similarly, bipolar spectrum disorder, chronic mood disorder characterized by recurrent episodes of abnormal mood elevation, the hypomania mania, and then depression on the low end that causes significant changes in energy, judgment, functioning. It often includes creativity, as shown in Carrie Fisher, but also impairment and dysfunction at other times. Medication adherence, insight, very important. And like we saw in about 50% of people, it can co-occur with substance use disorders. Next category, pretty common one, anxiety disorders. I think you'll recognize this first British singer songwriter by the name of Adele. And Adele achieved global fame with four massively successful albums. They're all numbered for the ages that she was at when she wrote them and produced them, which is kind of neat. And all four albums have been major bestsellers. She's won numerous awards. She's one of the world's best-selling artists right now. And she's known for this emotionally resonant lyrics centered on loss, relationships, identity. And a lot of people would be surprised that she has significant anxiety. And fortunately, she's willing to openly discuss it. And even though she's on stage a lot and has been doing this for a long time, she has very significant performance anxiety. As you can see here, she has anxiety attacks, constant panicking on stage. Her heart feels like it's going to explode. She never feels like she's going to be able to deliver, ever. So this leads to panic attacks, intense fear, what we call performance anxiety. It spins off depression at certain points in stages of life, which is very common for all mental illness to be a little bit exacerbated sometimes by stress and stages of transition. She spoke as such. One of those transition periods was when she had her son. She had a lot of peripartum, postpartum issues with anxiety and depression, and she was able to speak out about it here. She emphasizes the benefits of talk therapy, setting healthy emotional boundaries for herself, and self-care. And she, talks the talk, walks the walk. She's postponed, canceled performances to prioritize her own mental health, as she should and needed to do during those times. So she's cited as a high functioning individual with an anxiety disorder, as well as the importance of public disclosure and reducing stigma and educating the masses about, hey, even Adele can have anxiety and postpartum depression and anxiety. And look at this quote here. I have anxiety attacks, but I've learned that the more I talk about them, the less power they have over me, which is extremely important for people to hear. Again, help seeking encouragement. Now we're going to the sports world, the hard court. This is Kevin Love. By any accounts, no matter who you are, he's an incredible basketball player. He's achieved a lot of success on the basketball court, multiple time All-Star, NBA champion with LeBron James and the Cleveland Cavs back in 2016, Olympic gold medalist, known for rebounding, scoring, leadership on and off the court. He's kind of a locker room guy, glue guy. He's played for a lot of teams, and a lot of people think he's going to be in the future, a future Hall of Famer when it comes time. And I'm kind of in that camp. I think he's that good. And he was generally healthy, uh, no real psych history up until 2017. And he was in Cleveland playing in this game, and it's in this picture here. And all of a sudden, during the game, he had his first onset index episode, we call it, of a panic attack. And he didn't know what to do. He was discombobulated. He literally walked off the court, went into the locker room. After that, it spun off into anxiety, depression, isolation, despite the fact that he was this amazing basketball player. And during his recovery process, he used it to publicly emphasize his own therapy, his own support that he was implementing, and the self care that he was doing to get back on track. I love this quote, and no pun intended, but it came out of nowhere. This is the panic. I never had one before. I didn't even know if they were real, but it was real as a broken hand or a sprained ankle. And again, that helps make the abstract a little bit more relatable and appreciated by general public people. And much like some of these other people today, he founded the Kevin Love Fund here to promote mental health awareness and emotional well being. He's a staunch advocate himself for normalizing mental health conversations in professional sports, which was an area that kind of lagged behind. You know, a lot of machismo, fear of getting cut with these big salaries, fear of being traded. Not everybody talked about it. But due to Kevin Love and his advocacy, it helped shift the entire culture of this hugely successful league around mental health. And as such, the NBA has dedicated mental health professionals and a psychiatrist now on staff for every team available to players if and when needed. And they set the tone for that and pioneered that, and other leagues are now following NFL, Major League Baseball, NHL, etc. So we've seen leaders, we've seen a singer, now we're seeing a high functioning athlete managing his own mental health while performing at really Hall of Fame levels. Also, really like this quote, everyone is going through something that we can't see. How true is that? So, teaching points for anxiety disorders, take home points. Anxiety is this normal survival response. It's part of normal life to have some degree of anxiety to help prepare us to, to do things, prepare for danger, be careful. But an anxiety disorder happens when this alarm system becomes too hyperactive, too sensitive, too dysregulated, and won't shut off like it should. So it's certainly not a weakness, certainly not a lack of faith, it's not a personality flaw. It is a true medical condition, as is the other mood disorders involving brain chemistry, learning, life experiences, all kind of underpinning these disorders, what we call the biopsychosocial model in the field of psychiatry and psychology. Anxiety disorders also very common, but also very treatable, usually through a combination of therapy and or medications. And just, take home point clinical pearl, avoid dismissing somebody with a true anxiety disorder as just stress or stress. You don't want to kind of minimize the fact that they have a medical condition. Okay, now we're to the diagnosis that this foundation is founded upon is schizophrenia spectrum. And probably one of the more well-known uh, people with diagnosis of schizophrenia is this man here, John Nash. John Nash was an American mathematician, and he's our second Nobel laureate of the night, and this time it's for economics. And he achieved great success in the economic world. His theory, such as this game theory depicted here, is still taught in universities and colleges around the world. He achieved significant academic success at premier institutions like Princeton, MIT. He's recognized as a brilliant mathematical insight person, and he endured a lot of, influence on the field of economics and mathematics. He was diagnosed with chronic schizophrenia, likely paranoid type when they were still doing it that way. A little later in life, typically in a male, it's late teens, early 20s, but his was early 30s. And he experienced, the classic criterion A, DSM-5 criterion A symptoms of positive symptoms with hallucinations, delusions, and some negative symptoms with the social withdrawal, leading to periods of hospitalization for himself, as well as disrupting his professional career at times. And he's very notable for long-term management of severe mental illness while maintaining this intellectual productivity to the point where he is able to win a Nobel Prize, as we saw. And this is another quote that he's relating like mathematicians with mental health conditions. I don't really like the term madness, but he used it. I think that can be stigmatizing, so you have to be careful with that. It's not very clinical either, but it is his quote. He managed his illness through a combination of medication, psychotherapy, personal coping strategies. He was ultimately able to return to his professional work. He resumed teaching, research. His whole story is highlighted in this book by Sylvia Nasser called A Beautiful Mind that was later turned into this Academy Award winning movie. And Russell Crowe was the man chosen to portray John Nash. So, as I keep saying, another example of a high functioning individual who lived in recovery with schizophrenia. Next is another, this is the first of the two people that I've seen talk in person and live at a conference. Her name's Ellen Sachs, and Ellen Sachs is a legal scholar, mental health advocate, professor at the USC Gould School of Law. She wrote a book here, The Sinner Cannot Hold My Journey Through Madness. Again, not a big fan of the madness thing, but it's her book, memoir from 2007. And she's now recognized for her, prolific teaching, writing, and advocacy on civil rights and people with mental illness. So she's really big about schizophrenia awareness, destigmatization, using patient-centered terminology. It's a patient with schizophrenia type of thing. She was diagnosed earlier than John Nash in her 20s. She experienced hallucinations, delusions, some mood symptoms, so positive and negative symptoms, periods of hospitalization, intensive psychiatric treatment early in life. And she says because of the stigma, she was a little bit late to publicly disclosing it. But now that she has, she's very strong advocate on, normalizing this illness and making it more, people more aware. So here's another person living with schizophrenia in recovery, very high functioning in their personal and professional lives. She maintains her symptom through therapy, medication, support systems, uses her experience to lived experience to educate the public, reduce stigma. She spoke at an American Psychiatric Association conference that I was at out in San Francisco, and she was phenomenal. She's like said, advocates for patient rights, mental health reform, and access to timely, safe, evidence-based care. So here's her quote: portray people with mental illness sympathetically, portray them in all the richness and depth of their experience as people, not diagnoses. That's that person-centered language. So here's our third person with disclosed schizophrenia, another athlete here. Back in the days of Vince Lombardi, when the Packers were winning 2 Super Bowls, their most dependable defensive lineman was this man, Lionel Aldridge. And he had a very stellar NFL career, a whole decade of 10 years, won 2 Super Bowls. After his retirement, things were still going well. He landed a sportscaster job, as you can see here. And shortly thereafter, he started to experience his first symptoms of schizophrenia, of paranoia, delusions, disorganized thinking, all very common symptoms in schizophrenia. And it kind of derailed his career. He was not able to continue on as a sportscaster. And this is way before 2017 when Kevin Love was speaking out. Back then, most people did not speak about mental illness in athletes. So, unfortunately, he went a long time without proper treatment or diagnosis. This led to a period of homelessness for about 10 years um, in the streets of Milwaukee, where he was from. And again, due to misunderstanding, not being aware, stigma, what have you, he was often mistaken for being intoxicated, unmotivated, etc. Once he got properly diagnosed, proper medications, he was able to go into recovery and achieve significant stability and recovery, became housed, functional, engaged, married, and turned into a mental health advocate. So he says here, once I accepted and cooperated with treatment, I started to beat the illness. And then this is a good quote from him. My accomplishment is that people are hearing what can be done. People can and do recover from mental illness. So, like I said, in a time where it wasn't very common, he was out there speaking, became a public speaker, talking to many different professional groups, including law enforcement, community groups, emphasizing that schizophrenia is a medical illness, brain disease, and he's often quoted as saying, you need to find the right medication for you, whether that be, you know, fill in the blank medication. So, another good example of somebody that was able to enter into recovery. The last of the four highlighted individuals with schizophrenia tonight is Brian Wilson. Brian Wilson was a true beach boy back in the day. He grew up near a beach in Hawthorne, California, and along with his brothers, he co-founded, was the primary songwriter, producer, creative force behind the very famous band, the Beach Boys. He basically revolutionized pop music production using these layered harmonies and studio experimentation. And he was kind of the brainchild behind their most famous album called The Pet Sounds here. He began experiencing severe mental health symptoms in his early 20s, which is more the kind of typical onset. He had hallucinations, paranoia, disorganized thinking, and very extreme anxiety. This led to a functional decline for a while. He became socially withdrawn, fearful, unable to work in the band anymore. And for a while, unfortunately, he was misdiagnosed. He was treated unconventionally by a Hollywood psychologist by the name of Eugene Landy that was problematic, and it probably ultimately led to a period of worsening functioning. But fortunately, through family intervention in the 80s and 90s, he got more standard, structured, evidence-based care, therapy, rehab support, and this was able to help him achieve stability. And he recovered to the point where he's able to return to performing and recorded music. He even went back to a album that he had kind of let go because of his illness called Smile, which is widely acclaimed now today. So Brian Wilson is truly regarded as one of the greatest composers in modern popular music. He's often compared to classical composers for this harmonic complexity. You see him in front of his soundboard here, and his innovation in the studio. Major influence on the music we're hearing today, pop and indie music. He's a musical genius whose groundbreaking creativity, personal struggles, and eventual comeback made him one of the most compelling figures in rock history. Here he is accepting the Hall of Fame induction in the third class in Cleveland in 1988. This is a very nice documentary that's streaming on the services now. Brian Wilson, Long Promised Road, as well as his relationship with the former editor of the Rolling Stone magazine. Pretty good documentary. Teaching points with psychosis, spectrum, and schizophrenia. Truly, schizophrenia is a medical brain disorder. It's not this kind of character flaw or misnomer of split personality. It affects how a person thinks, perceives reality, expresses emotions, and relates to others. About 1% of the population worldwide is diagnosed with schizophrenia. It does not erase intelligence. These four people are clear examples of that. Treatment and support lead to meaningful recovery. You're seeing that in all four people. Media portrayals are often misleading. We all know that. I'm speaking to the choir there. Recovery is possible with evidence-based treatments, and treatment plans, which is going to be a little different for everybody. Obsessive compulsive and related disorders, I think probably two people highlight this most for me. One is another one that I've seen speak in person, and he was very good. Howie Mandel, a Canadian comedian, actor, television host, producer. Most people know him from Deal or No Deal or America's Got Talent. I did not realize till I put this talk together that he's a very prolific voice actor doing voiceover work, and he's Gizmo from the Gremlin movie. I didn't realize that. He's publicly disclosed obsessive compulsive disorder and attention deficit hyperactivity disorder. He's got classic OCD symptoms in terms of germophobia, fear of contamination, compulsive hand washing. He's widely credited with popularizing the fist bump, which he was doing instead of having to do a full handshake. And he did it so much, it kind of gained mainstream popularity in the 2000s, especially in sports and pop culture, largely due to his influence. So talk about power and influence of celebrities. This is a good example of that. He's reported that he experiences panic attacks, much like Kevin Love, much like Adele, triggered by stress and public appearance, despite that he's been doing it a lot of that his whole life. He uses therapy. He's upfront about medication, structured routine, all very important stuff. Openly discusses his mental health to reduce stigma, encourage help seeking. Here he is on the cover of People. He's like a brand ambassador for this online platform that helps with virtual treatment of OCD. He promotes awareness that successful individuals may still face significant mental health challenges. They can coexist with high functioning people and lives. Um, and he says, everybody's going through something similar to what Kevin Love said. OCD is not an embarrassment anymore. Just know that there is help, and your life could be better if you go out and seek the help. So again, another prime example of help seeking encouragement. Another famous person with OCD diagnosis is this man, Howard Hughes. He was an American business magnate, aviator, film producer, inventor, had a lot of films, a lot of businesses. He actually was one of the most wealthiest person in the world at that time, right up there with like J. Paul Getty. He was actually cited as the first U.S. billionaire. He made these planes like the Spruce Goose here and this other experimental craft and was very successful. But as his life progressed, he had more severe symptoms of OCD and other anxiety disorders. Similar to Mandel, he had a lot of germophobia, fear of contamination, social anxiety. He was very compulsive, hoarding behaviors. He famously checked into a hotel in Las Vegas Thanksgiving of 1966, I believe, and he wouldn't leave. He couldn't leave because of his symptoms. And the hotel, he was in a penthouse, were trying to evict him and wanted to kick him out. And he famously ended up buying the hotel and stayed there for many more years and left in 1970. 4 years later, had not left the hotel because of his symptoms were so severe. And this is all detailed in this Pulitzer Prize winning biography. The third time we've seen the term madness, which is I'm not a big fan of. Here's Time magazine with the spruce goose on it. Unfortunately, he went largely untreated for most of his time, which probably led to a worse outcome than if he were treated conventionally. But he was still, despite that, able to maintain some degree of success in business and aviation and kind of at the nexus of all these things coming together. But he's more of an example of highlighting, not getting proper treatment, and it affected his life later on. This is depicted in this Leonardo DiCaprio movie called The Aviator. Teaching points here: OCD, another medical condition, not a personality quirk. It's not just neatness. That's too simplified. It's not liking symmetry. It's involving obsessions, compulsions to the tune of hours a day, not seconds, not minutes, but hours that truly impair and distress that individual experiencing them. There's some really good evidence-based treatments. The biggest one is exposure and response prevention, very good. CBT, cognitive behavioral therapy, also very good. And certain medications can be very effective treatments for obsessive compulsive disorder. Um, Second to last category, trauma and stressor-related disorders. Going back to a singer here, Lady Gaga. Her real name is Stephanie Germanotta. She's a singer, songwriter, actress, activist known for bold performances and artistic reinvention, multiple awards, global influence in music and culture. She's an advocate for LGBTQ plus rights and mental health awareness. Openly discussed her diagnosis of post-traumatic stress disorder following a sexual assault at age 19. And, she's very forward in saying if you see somebody that's hurting, don't look away. If you're hurting, even though it might be hard, try to find that bravery within yourself to dive deep, go tell somebody, take them up in your head with you to kind of, open up and talk. She also lives with chronic pain, fibromyalgia, uh, depression, anxiety, panic attacks stemming from that. She normalizes conversations about mental illness for herself and others, and individual acts of bravery and compassion can change the world. It's time to do the same for mental health. She herself practices therapy, mindfulness, creative expression as her coping strategies. She runs this nonprofit, as you see here, Born This Way Foundation, promoting youth mental health and wellness, uses her public disclosure to reduce stigma, encourage help seeking, like we keep saying, and another high functioning artist person openly managing their mental health. Similarly, Oprah, um, media mogul, talk show host, producer, actress, philanthropist, very influential, first African American female billionaire and globally recognized icon. She experienced childhood trauma herself, including abuse and neglect, which she's disclosed, contributing later on to mental health challenges, similar to what I said earlier about the adverse childhood experiences, depression, anxiety. Um, Talks a lot about self-awareness, therapy, support networks, and the like. She advocates for mental health awareness, self-care, emotional resilience. She uses her platform and media presence to encourage therapy, self-reflection, community support. Here she is interviewing Prince Harry of all people. Here's Glenn Close, back to what I said earlier about, a current mental health advocate. Encourages reducing stigma, fostering open dialogue about mental illness, and very successful individual, managing her own mental health challenges. And this quote here at the end, we need to start talking. We need to start now. Trauma responses are adaptive survival responses. It's kind of built into our DNA. When we're exposed to, life-threatening, stressful situations. Not everyone experiences trauma, will develop a traumatic and stressor disorder, but sometimes you they will, and it reflects the brain and body's survival response getting stuck on in terms of the amygdala and the fear circuitry in the brain. And they are truly medical and psychological conditions, not weaknesses, not lack of resilience. Healing, recovery often includes therapy, safety, connection. We hear that time and time again. Trauma does and never will define a person. I'm always quick to point out many survivors of trauma demonstrate profound resilience and post-traumatic growth. An example of post-traumatic growth analogy would be this kintsugi artwork in Japan. They break a glass, then they glue it back together piece by piece, paint it with gold so it's stronger and more beautiful than before. Again, to represent the post-traumatic growth. Last category here as we wrap up, feeding and eating disorders. Another well-known individual in entertainment is Demi Lovato, as you see here. Singer, songwriter, actor. Some of you may have seen her grow up on the Disney Channel as a child. She advocates for mental health awareness and body positivity because she herself had a significant eating disorder through most of her years. She uses this, platform that she has to speak openly about her personal struggles. Additionally to the primary eating disorder, she's got mood disorders, anxiety. Her eating disorder symptoms included classic kind of purging, body image distortion, unhealthy coping behaviors, etc. And it kind of highlights the interplay between all these different conditions. She's got this documentary on YouTube that was produced in 2017. I looked today and it's got 42 million views. And it talks about her recovery, road to recovery, and process that she used. And it's very powerful. As much as I'd like to think that Bethany's YouTube channel could get 42 million, I don't think we're going to. That's an example of the reach and the power that Demi Lovato and some of these other people have compared to everybody else. This is a recipe book that she published just this year, one plate at a time, dealing with, freedom from food and eating disorders. So that's also another good thing she does. And finally, Michael Phelps, another athlete here. Um, he's an American swimmer and truly the most decorated Olympian of all time. 23 gold medals, as you can see around his neck here. Known for his dominance in swimming, discipline, and now advocacy for athlete wellness. Many people probably don't or didn't realize that when he was competing, he himself had a form of disordered eating, disclosed struggles with that, restricting, binging, purging type of thing, leading to body image concerns like Demi Lovato, extreme dieting, compensatory behaviors. When he stopped competing, it led to depression, anxiety, even a period of suicidal ideation in 2015. And again, showing that this link between high performance pressure, mental health, eating disorders. He sought therapy. You sometimes see him on commercials promoting talk therapy, medication, support from family and coaches. This quote here, he never thought that his story from 2015 when he had depression and suicidal ideation would catapult him into this world of, potentially saving a life. Um, he advocates for mental health awareness in everybody, but especially athletes and swimming and competitive sports. He works to destigmatize mood disorders, eating disorders in men and elite athletes when most people think more females and eating disorders. Another high functioning person addressing complex mental health challenges. Teaching points for this last section. Feeding and eating disorders are serious medical and mental health conditions. They know no boundaries. They have actually one of the highest mortality rates of any psychiatric illness because of cardiac complications and renal kidney function concerns that can result from untreated feeding and eating disorders. Obviously, you can't tell oftentimes who has an eating disorder by looking at them. You wouldn't have thought Michael Phelps did when he was winning 23 gold medals. Early treatment greatly improves outcomes. Treatment in this category involves a comprehensive approach with therapy, doctors, dietitians, nutritionists, and social support. So, as we wrap up here, my key takeaways for all of you tonight: mental illness is common, treatment works, treatment is out there. We have really good treatments, very good therapies, very good medications, very good support networks. Recovery looks different for everyone. These are heterogeneous illnesses, heterogeneous treatments. Language matters, so be careful. Like Ellen Sachs said, try to use patient-centered, person-centered first language. Try to avoid stigmatizing terms, whether it be madness or this or that. Support and compassion saves lives. Many of the people today are examples of that. My call to action to you all: speak openly, if and when appropriate, about your own mental health. Challenge, fight stigma when you see it, when you encounter it. I've seen it get better in my 27 years of practice, but we still have a ways to go. It still exists, these kind of negative attitudes and biases. Support access to care, timely care, evidence-based care. Care works. Share crisis resources if and when needed. If you want a copy of these slides, I'll provide them to Bethany and she can send them out. But we're 3.5 years into the 988 Suicide and Crisis Lifeline, which saves lives. It's available 24/7, 365 to talk to somebody that's trained to help you and de-escalate symptoms. My favorite organization of NAMI, great resource, good education, good information. Mental Health America, they're actually sponsoring Mental Health Awareness Month in May. And of course, this great organization started by Bethany and Dr. Nasrallah, CURESZ. And there's many others, but these are just four that you can have handy. So, as we conclude, mental illness is common, knows no boundaries. Even the world's most famous, successful people, we just saw 15 examples of that, can and do have psychiatric disorders and need for treatment and ultimately can live successful lives. There are numerous examples of this in history, media, sports, music, entertainment, celebrities sharing their own stories of mental and emotional well-being. These public disclosures are truly increasing mental health awareness, enhancing efforts to encourage other people to seek help, that all-important help-seeking encouragement that I want to kind of promote as well. It can be really inspiring when well-known individuals share aspects of their own mental health struggles and experience, going back to that role modeling principle. Mental health treatment works to improve health and function. Do not be ashamed to ask for such help or explore ways to treat any personal mental illness yourself. So, with that, I thank you for your attendance, your attention. I welcome any questions, discussion, comments.